Hi, everyone. Welcome to today's free training. I really enjoy doing these, and I hope you all have been enjoying them too, whether you're joining me live or watching a replay. For anyone who's new to the group or to my world, I'm a clinical psychologist. I have a specialty in chronic pain management. I help women, often women who identify as perfectionists or high achievers. I help them reconnect to the things that bring them joy, vitality, and give them ways to sustain productivity and just basically get back to their lives. I have a program for this, which I can talk about a little bit later. But I also like to do this partially as well through these live trainings. Today, we are talking about a topic that's not only important, but it's also deeply personal for many of us. I know this. I've experienced it, and that is advocating for ourselves, particularly as women dealing with chronic pain. We know that living with chronic pain can be an isolating and challenging experience, and it's so often that we find ourselves in doctors' offices feeling unheard, dismissed, invalidated. But today we're here to change that narrative. And today's session is not just about sharing information, it really is about empowering you, about reclaiming your voice, asserting your right to compassionate and effective healthcare around your pain. And it's about kind of trying to break free from that stigma that exists and misconceptions around pain that just won't go away, especially for women. So, throughout this session till today, we are going to explore practical strategies for effective communication with healthcare providers, debunking myths and biases that may stand in the way of receiving proper healthcare, and we'll also dive into the importance of reconnecting with that intuition we have, that innate wisdom within us that often gets drowned out by external noise. So, why is this topic important, particularly for women? So, I talk about this a lot in my social media posts in a more detailed and specific way, but I think it's just important to acknowledge that there are gender disparities and stigma faced by women dealing with chronic pain. Generally, women are often disproportionately affected by chronic pain conditions, but they encounter unique challenges in accessing appropriate care. Common challenges women encounter include dismissal of their symptoms, delays in diagnoses, inadequate pain management. Sometimes their experiences may be directly or indirectly minimized or psychologized, and this leads to a lot of frustration and feelings of invalidation. And I've heard this from so many women in their stories. And my hope is that you gain knowledge today to reduce the likelihood of these experiences. So let's start by just talking about what chronic pain is very briefly, and that impact it can have on our daily lives. So, of course, chronic pain isn't just a temporary discomfort. The actual definition states that it's pain that's gone beyond 6 months, and it's an ongoing sensation. It can persist for weeks, months, years, decades, and it can manifest in so many forms. It can feel like sharp pain, stabbing pain, dull pain, achy pain. It can affect all different parts of the body. But we also know that chronic pain isn't just physical, it's deeply intertwined with our mental and emotional well being. And this is where that biopsychosocial model of chronic pain comes into play that I talk about all the time. Unlike the traditional medical model, which focuses only on the biological aspects of pain, the biopsychosocial model recognizes that chronic pain is influenced by a complex interplay of biological, psychological, and social factors. So, in other words, chronic pain isn't just about what's happening in our bodies or our sensations, it's also about how we perceive and experience that pain, as well as our social and environmental factors that shape our pain experience. Stress, anxiety, depression, trauma, even social support networks can all impact how we perceive and cope with chronic pain. So, when we can understand the interconnectedness of these factors, we can adopt a more holistic approach to our chronic pain management. We can decide for ourselves that we know that any approach that doesn't address all of the pieces of pain, the biological, the psychological, and the social, is not addressing the whole picture. So if you are meeting with a provider and they are not using a biopsychosocial approach for your pain, and we'll talk about how to know that later, then they're using an outdated method for your pain and you need to find a new one or have a conversation with them about this. The holistic approach recognizes that treating chronic pain requires more than just medication, surgeries, or procedures. It requires something that's comprehensive, multidisciplinary, addresses, overall well-being, your overall goals, your values, what's happening in your life, the way that you're coping, the way that you're thinking about all of this. And so as we continue our discussion today, let's keep in mind that the holistic and biopsychosocial nature of pain and this importance of addressing all of these factors in our journey toward recovery and improved quality of life. Now that we've talked about the holistic approach to chronic pain, let's talk about the limitations of a purely medical approach. So while medication and medical interventions definitely play a role in managing chronic pain, I am never here to poo-poo that. That is a really important part of pain management, often for a lot of people. But when we're thinking only about those approaches, they often only address the physical symptoms without addressing underlying causes or other things that can keep pain going and keep threat level high. And that would be psychological and social aspects of pain. So what this means is that we're basically getting incomplete treatment to a problem that is multidimensional and unique to you. And this is why we often leave our doctor appointments feeling frustrated and misunderstood. Additionally, a purely medical approach can focus too narrowly on symptom management, trying to put the Band-Aid on and stop the bleed, rather than promoting more overall well-being and quality of life. And so it can really often overlook the importance of addressing things like stress, trauma, lifestyle factors, and social support, all of which can significantly impact someone's experience of chronic pain. How do we advocate for a provider who's going to give us that holistic biopsychosocial approach? And so this is where advocating for a healthcare provider who adopts this approach really becomes crucial. So one who embraces this approach is someone who recognizes that pain is a multidimensional experience and requires a comprehensive treatment plan that addresses physical, psychological, and social aspects of pain. When you can find this healthcare professional, you're more likely to receive personalized care that considers your unique pain experiences, acknowledges that interconnectedness of the factors influencing your pain, and this can empower you to actively participate in your treatment. So with a purely biomedical or physical approach, we're pretty passive, right? We're sitting there waiting for them to do something to us or for us, like a procedure or give us medication. And we're pretty passive in that, and our doctors are the experts. When we're using a biopsychosocial approach to pain, we are empowered to actively participate in that. We are empowered to learn about the factors that we can have some control over and participate in changing the outlook. And that sounds a little bit scary. It sounds like it takes longer, but it's the best way to approach chronic pain, at least according to current day research. And so how do you identify healthcare professionals who prioritize this type of comprehensive care? Well, so here are a few tips. So first, you obviously want to look for a provider who is taking a collaborative approach to care. So that means that they are involving you as an active participant in decision making and treatment planning, as well as, you are doing things for yourself. If it suits you, you can seek out practitioners who are known to have experience and training in integrative or complementary therapies. And this could look like just knowledge about or ability to educate you on the benefits of things like, for example, occupational therapy to help you with routine and energy management and pacing, or a physical therapist with knowledge around the neuroscience of pain and the role of threat, or mindfulness-based practices, or something like a cognitive behavioral approach to pain, for example. You can ask questions about their treatment philosophy and approach to chronic pain management during initial consultations or appointments. So pay attention to how they respond and whether they demonstrate an understanding of the biopsychosocial model, the idea that pain lives in the middle of these three bubbles: biological, psychological, and social. Here you can also consider seeking recommendations from any trusted sources, friends, family members, support groups, online communities who've had positive experiences with healthcare providers taking a holistic approach. This is one step toward receiving more comprehensive and effective care. And so if you have a provider that is only talking to you about labs, diagnoses, medications, faulty movements, damaged tissues, and your pain level, and not talking to you about the things you miss since you have pain, the things you want to get back to, how you can get back to moving your body, and using language that reduces fear and increases safety, then I recommend finding someone else or talking to your doctor about a change in approach if you're able. Okay, let's talk about sort of the power of language in healthcare interactions. So it's no question that language is a powerful tool in healthcare interactions. The words we use are so powerful for pain because they can either fuel fear and threat responses in the brain, which causes it to protect us with pain, or it can promote feelings of safety and trust. So, especially for individuals dealing with chronic pain, where fear and threat responses might already be heightened, the language used by healthcare professionals can significantly impact our treatment experience. It can impact the way we talk about our pain, the way we think about our pain, the way we cope with our pain, and how we're feeling emotionally as well. Quickly, let's just 2 sentences here understand fear and threat response. So, when we're in pain or facing a threat, our brains are constantly working to protect us. Our brains are always assessing for threat and danger. And oftentimes it will produce pain to protect us. When our brain is feeling safe, it does not need to produce pain to protect us. Negative or fear inducing language in appointments can activate these threat responses, triggering a cascade of physiological reactions that exacerbate pain and stress levels. And so, how do we assess someone's language, our provider's language, for safety and threat? During your appointments, it's essential to pay attention to the language used by your healthcare providers. Are they using words that instill confidence, reassurance, a sense of safety, or are they inadvertently fueling your fear and threat responses with language that focuses on risks, limitations, and worst case scenarios? And how do you advocate for safety based language? If you're finding that your healthcare provider's language is contributing to feelings of fear or threat, don't hesitate to speak up. Requesting more safety based language can help shift the conversations toward a tone that's more empowering and more supportive. Examples of empowering language might be, instead of saying, you have to live with this pain forever, you'll have to learn how to live with this. You'll just have to accept this pain. They can say, let's work together to find some strategies and treatments that can reduce the level of threat that's driving your brain's protective response and improve your daily functioning. Let's increase the sense of safety for your brain. Instead of saying your condition is worsening, we can say instead, we might need to adjust your treatment plan to better address your evolving needs. Instead of saying, your condition is incurable, we can say, hey, this condition is super challenging right now. There are treatment options available. There are things that you can do to help manage symptoms and get back to the things that you love. So we're not talking about toxic positivity or being fake positive, right? We're talking about shifting the language. The last thing I really want to talk about is sort of reconnecting with your female intuition in healthcare decision making. So many women, including myself, I've had this experience. We navigate the healthcare system for chronic pain, and we can eventually find ourselves disconnected from our own intuition for one reason or another. So, we're going to talk a bit about why that happens and how we can reconnect with that powerful inner guidance. Female intuition is often described as sort of our gut feeling or this inner knowing, this innate ability that we have as women to sense and understand things beyond logical reasoning. It's a deep, intuitive understanding that arises from our subconscious mind and lived experiences. In healthcare decision making, female intuition can really play a crucial role in guiding us toward the treatments, the providers, and the practices that align with our unique needs and preferences. But we have to reconnect with it. We have to remember to learn how to hear it and listen to it. Societal factors, though, things like gender bias, cultural norms, institutional hierarchies, there are so many external factors that can disconnect us from our intuition. Maybe it's even been the language in your treatment appointments that you no longer trust yourself or what your body's telling you, or you no longer feel safe in your mind or your body. It disconnects us from our intuition. We're often socialized to prioritize others' needs over our own, to defer to authority figures, to suppress our instincts in favor of external validation. And in the context of healthcare, our experiences can lead to doubting our own experiences, downplaying our symptoms, and feeling disempowered in times where our decision making process is important. So, how can you reconnect with and trust your intuition in your healthcare decision making? So, mindfulness is one great way to strengthen this muscle. So, taking time to tune into your body and emotions through mindfulness practices, things like meditation, deep breathing, body scanning, and just also paying attention to how different treatments or decisions make you feel on a gut level. So, we can do mindfulness exercises, but we can also practice everyday mindfulness where in certain moments we stop and we notice, how did this moment make me feel on a gut level? What is my gut saying? What is my intuition saying? And just taking a moment to notice that. I don't suggest journaling for a lot of things, but journaling can be great here, right? Keeping a journal to track your symptoms, your experiences, your treatment outcomes. When we're tracking treatment outcomes, like how do we know that something worked? Did it get you back to something you enjoy? Are you sleeping better? Are you seeing your friends more? Reflecting on how certain treatments or certain choices resonate with you, whether they align with your intuition and the things that are important to you, like your values. In my Breaking Through Pain program, I actually have a whole section at the beginning that allows you to explore your chronic pain story, the language you've heard, the experiences you've had, to create a new compassionate understanding of what happened, ground you in your present and your own intuition, and provide a more compelling and empowering narrative to move forward. And sometimes this can really place us in a beautiful spot that we can show up to our appointments in a new way, knowing what we need, knowing how to ask for what we need, and knowing how what we want our behaviors to be driven by, which are the things that are important to us, right? Another option is seeking support. So, when we're talking about intuition, it's really important to surround yourself with people who validate your experiences and encourage you to trust your intuition. So, discussing your concerns openly, seeking insights and perspectives from someone that does encourage the trusting of this intuition. A great example of this, I saw a doctor today just about some, random changes that are happening as I'm aging. And, she said, and I think, and I'm someone that's really in tune with what my body is feeling and experiencing. And she said something today that was just so powerful that no one has said to me before. Because oftentimes when I show up to a doctor's appointment as someone who is really interested in that mind body connection and who's always paying attention to these sensations and experiences that I'm having in my body, and then bringing them to doctor's appointments, sometimes I feel like I overwhelm them, or they think I'm crazy, or oh my gosh, this person needs to just let it go, right? But I also have intuition, and I listen to these things that my body is telling me. My body is letting me know that something is important. And this provider today said to me, you're a person that's really in tune with your body. You're noticing things happening with your body, and then you're bringing it here to talk about because you want to be proactive about your health. And she said, that's a wonderful place to be. And I said, is it, or am I too hyper vigilant? Like, how do I know if I'm in a good place with this? And she said, ideally, we are in tune with our bodies. We can talk about these things, and then we can find a way to flow with or work past these things. But it can also, everything's on a spectrum. I think she said, the more unhelpful side of that spectrum is being hypervigilant, where it's hard to work through these things. It's hard to experience these things. And then we start to fear and worry about these things, and our threat level goes up, because that hypervigilance really turns on the stress response in our body. So I just thought that it was really empowering her, right? She's empowering me to be in tune with my body. She's telling me that this is a healthy thing to be, a safe thing to be, and kind of telling me, where that line is, right? And I thought that was just so lovely and powerful. So, surrounding yourself with people who support you like that, educating yourself. So taking an active role like you are, if you're attending this training, in understanding how we should approach chronic pain, the neuroscience behind pain, the most updated way and philosophies for viewing pain. Because this knowledge is always going to be powerful for you. It will help you make informed decisions that more align with your intuitions and your goals. And listen to your body. So pay attention to your physical sensations, your emotions, your energy levels. Consider that this information your body is giving you is valuable. It's valuable information, and this can guide you toward what is right for you, whether that's your gut feeling or your sensations. When we can reconnect with and trust our intuition, we can reclaim our agency and advocate for our well-being with confidence and clarity as we go through our healthcare journey. Just a few more kind of practical tips for self-advocacy. I know sometimes this can feel daunting, but with the right strategies, you really can assert your needs and ensure that you get the care you deserve. So obviously coming prepared. I think when we prepare for whatever it is, appointments, a busy day, a stressful week. We're able to plan ahead and approach things better than if all we did was react to everything that comes up. So when we go into doctor appointments, we want to be prepared. So taking a few moments to prepare, write down your values, the things that are important to you, write down what your body's been telling you, questions you have, approaches that you deserve, right? That you are looking for a philosophy that centers around a holistic and biopsychosocial approach. Just kind of having this handy or in your back pocket, just kind of a plan ahead of what you expect from this meeting and how you plan to approach it. Being clear and assertive. So, about your needs and concerns. So, using I statements to express how you've been feeling and what you need. So, instead of saying you're not listening to me, you can say, I feel like my concerns aren't being fully understood and I'd like to discuss them further. You can ask questions. Don't be afraid to ask questions if something's unclear, if you need more information. It will always and forever be your right as a patient to fully understand what's happening in your body, your treatment options, and any potential risks or side effects. Also, the philosophy of your provider and how they're approaching your condition. And if you're unsure about a recommendation, you can ask for clarification or for other alternatives. You can also seek a second opinion. If you're unsure about what's being discussed in your appointments, don't hesitate to seek a second opinion. Getting another perspective can sometimes be so valuable. It can give you new insights and help you make more informed decisions. And always keeping the lines of communication open with your doctor for follow-up as needed. So we talked about using I statements, so active listening. I know this is just sort of like, it sounds like such a like a cliche thing to talk about but when I think of active listening, I definitely think of listening attentively to what our healthcare provider is saying and asking questions to clarify. But when I think of active listening, I also think about listening and then tuning into your gut and what your intuition is telling you in that moment about what they are saying. And so that is a practice that can help build that intuition muscle. And it might feel a little bit harder at first, but the more you do it, the more you can respond more more intuitively in these conversations. And setting boundaries too, right? If your healthcare provider should respect your autonomy to some degree and help you work to find a solution that aligns with your values, your preferences, but also your expectations for outcome. And I share this all the time. It should be no surprise that my expectation for outcome is not, does my pain go from a 10 to a 0 on the scale? It's really about the things that are important to me. Am I sleeping better? Am I getting back to my life? Am I seeing my friends? Am I slowly getting back to my hobbies? And my boundary is, when I come to my appointments, I don't want to end at just the pain level. I want to talk about what can I do between now and the next appointment to slowly get back to my life without flaring up my pain. A few simple tips to tie it all together before we wrap up. Trusting your instincts, your instincts, your intuition is a powerful tool. Educate yourself. You're doing that here so that you know how to approach your appointments in a really educated way about up-to-date philosophies around chronic pain management. Speaking up, being assertive, and making sure your voice is heard. And if it's not being heard, then I think it's time to find another doctor. Build a support network. So, again, surrounding yourselves with individuals who are supportive and encouraging you to trust your intuition and who validate your experiences. And prioritize your well being, prioritize your values, what is important to you, and in terms of outcomes, what is most meaningful for you to get back to in your life. That's all that I had for you today. I encourage questions if you have any. So you can type a question in the chat box, whether you're attending live or attending the replay. Share your own experiences with some of these topics we brought up today. Share any residual questions or things that I didn't address. I can always do more training on this. I really want to express my gratitude for your participation today in this training and your commitment to empowering yourselves in your chronic pain management. If you're listening to this and you want to be able to get to a place where you feel more empowered by education, your intuition, your narrative or your story, as well as being empowered with new skills to approach your pain and getting a good grasp on the neuroscience of that, I invite you to contact me and let's talk about my group program. This is a place where I give you all of the foundations you need to feel empowered about your pain and move forward in a confident way. And we make real changes in your day-to-day life by getting into the nitty-gritty of your day, the hour by hour, and talking about how can you participate in your day or approach your day so that you're not getting flare-ups and you're instead able to get back to the things that are important to you and that make your lives bigger and your life bigger and your pain smaller. That's what my Breaking Through Pain program is all about. So if that's something that you're curious about, we can do a no pressure 15-minute call where I would learn a little bit more about your pain and talk to you exactly what it is that I do. Whether that call ends in you deciding to participate in my program, I feel pretty confident that I can help you in some way. So we can think of it as sort of a strategy call. If that's something that interests you, just send me a DM or comment me in the chat here, and I'll send you the link to my calendar and we can get going with one of those appointments. Otherwise, thank you so much for attending. I have so much gratitude for all of you who are listening and being here. Educating about pain is my mission, and it's honestly one of my favorite things to do. So thanks for joining me today, and I will see you all again soon.